Welcome. We're going to get started here shortly. I would like to just go over a couple of things here before I introduce Patricia. My name is Andrea Locke. I'm a patient navigator at the Chordoma Foundation. We are hosting this webinar today. Thanks to Patricia, who's planning to share a lot of wonderful information about kind of navigating questions, concerns about nutrition for individuals and family members dealing with cancer. This session is being recorded, so we will have it available for everyone and posted on our webinar afterwards. We will be using the Q&A function for questions and answers at the end of the webinar. Patricia will talk a little bit more about that. If you do have any technology issues or anything like that, you can use the chat feature to reach out to us, and we'll kind of take care of that on the side. But let's go ahead and get started. I want to introduce Patricia Rubio. She is a registered dietitian at Moore's Cancer Center at UC San Diego. She actually did a presentation for us last year at our Chordoma Community Day. A lot of great information, and she's here to share the information again and expand on some other things. So thank you so much, Patricia.
Hi, everyone. My name is again Patricia Rubio. I do work at UCSD Health. I'm very excited to talk about chordoma and nutrition. Today, we'll be talking about healthy eating to optimize nutrition during cancer continuum. I will be focusing on what to eat before, during, and after treatment, and what the recommendations are. So when we look at chordoma, there's not any really specific nutrition information regarding the diet and say. However, there are nutrition guidelines for just healthy eating for patients that are looking, or wondering what should they be doing at home in order to optimize their nutrition during or prior to starting treatment. The American Institute for Cancer Research has a blueprint that they've put out. I'm going to kind of briefly go over it, but I am going to go more in detail in regards to recommendations. But when we're looking at this cancer prevention blueprint, we are looking at several different factors. We are looking at maintaining a healthy weight as an adult, being physically active, ensuring, walking more, sitting less. We are looking at eating a diet rich in whole grains, vegetables, fruits, and beans, limiting consumption of red and processed meats, limiting consumption of sugar-sweetened beverages, limiting consumption of fast foods and other processed foods high in fat, starches, and sugars. We're also looking at limiting alcohol consumption. For those that do drink alcohol, we usually recommend that, if you can limit it and not drink at all, that's actually one of the recommendations. We're going to be talking about, not adding supplements for cancer prevention, and I'll go into that a little bit later. And this is just a blueprint that's available on the American Institute for Cancer Research.org. Okay. So to start off with, I want to talk about what the recommendations are for just those patients that are seeking a healthy, balanced diet during treatment. So for chordoma overview, when we're looking at nutrition, there is no specific diet or lifestyle recommendation for chordoma patients rather than general health, physical activity, and then we will look at different sources that are available out there. I think that there is a lot of misinformation when you are looking up, like, what should I be eating? What should I be doing in regards to getting ready to start treatment? What should I be doing? Because there's a lot of confusing and conflicting information. These are well-vetted organizations that you can look up information that's kind of going to be in line with what the presentation is today. You can look in through the American Institute for Cancer Research, American Cancer Society, and the National Cancer Institute are just some of the few trusted sources. Okay. When we're looking at chordoma in general, we're looking at certain, what are the barriers to nutrition that we see specifically with this type of cancer? For cervical spine, we might see dysphagia, treatment-related side effects, which I will go into if radiation is part of your treatment. For sacral tumor resection involving areas of different areas of bowel function and how that might affect your dietary intake. We will go into a little bit later. So when we're looking at barriers of nutrition for patients that might be exhibiting issues with dysphagia, we definitely do recommend an evaluation by a speech language pathologist. They will be working with you in regards to texture modification, making sure that it's the appropriate consistency. It'll be easier to swallow. For some patients that might be undergoing treatment, there is a very small group that might require some form of alternate nutrition support, enteral or parenteral nutrition, if in extreme cases, if eating orally becomes a challenge. I'm going to go into this a little bit more in detail when we get into radiation and what to expect during treatment for different areas of your body. But that's for cervical spine chordoma. For sacral chordoma, surgical interventions when bowel is not functional. Some patients might be looking at a colostomy placement, which would be a little bit different in regards to the diet recommendations for that population. Okay. When we are looking at nutrition for oncology patients, okay, and I usually see this all the time. When patients come in, we do recommend for those that are already in survivorship, usually say maintaining a good, healthy weight that is stable. However, for those patients that are getting ready to start treatment, we do want to make sure that, weight loss during that treatment portion, we're not really focusing on that. We're actually making sure that you are eating, that we're helping ensuring that you're getting the nutrition that your body requires to prevent fatigue. We want to make sure that, if we're not eating very well, if we're having unintentional weight loss during treatment, you might have increased treatment toxicities or delays, reduced physical functioning, poor quality of life. Any weight management goals that can be addressed will be addressed after treatment. And when I follow up with my patients, we will look at that weight issue later if that is something that you want to work on with your individual dietitian. I cannot stress enough that when you are dealing with cancer, that you should get a nutrition assessment at the beginning of your diagnosis, just so that they can get a baseline assessment in regards to where you are at, and they will go over like what to expect during the course of treatment. I'm going to give obviously some general things that I usually see regarding treatment related, but every nutrition intervention is very individualized. So when you are meeting with a dietitian and they're looking at you during the cancer continuum, they are addressing any comorbidities that you might have, like if you're having issues with chronic kidney disease or diabetes. All of those come into play in regards to the recommendations for diet, okay? When treatment is started, depending on that treatment, you might find yourself finding issues in regards to being able to eat certain foods. Maybe you're having, definitely poor appetite. Usually I will recommend across the board, and I see all different lines of oncology patients, but usually we do recommend the consumption of small, frequent meal pattern of eating is usually what's recommended. A lot of patients do have a decrease in their appetite, which they can finding food sources, difficult in regards to like what they feel like they're able to tolerate. So making each bite count, considering calorie dense foods, is something that I find is very useful for a lot of patients. Okay. For patients that are undergoing any type of radiation, especially in this head and neck area, absolutely. Diets are usually modified during the course of their radiation to become softer textured foods, eventually leading to more smoothies, shakes, liquid foods. So protein shakes can be considered as meal ideas that they might want to incorporate into their diet to help in regards to helping maintain their body weight. I'm going to show you at the end of the presentation a site that I utilize to help create some smoothie ideas for some patients if they're like looking to look at ways to increase their intake if they're struggling with their diet. One thing that I tell patients is if you are undergoing treatment and you are not having really any alterations in appetite and you feel like you're tolerating your meals okay, then absolutely we do want to focus on a well-balanced diet. I want to make sure that you're having good sources of protein, that there's definitely a good amount of calories, a variety of veggies in their diet. Now, I want to stress that when you are undergoing treatment, specifically if you're undergoing, different lines of treatment like radiation, the diet might not look like the perfect, diet. The new American plate for oncology recommendations is to include 2/3 or more of your plate should be vegetables, fruits, whole grains, and beans. 1/3 of your plate should be protein sources. Here it says animal protein. It doesn't necessarily have to be animal protein. Some patients might choose to be vegetarian. Some patients might be vegan. When you work with your dietitian, they will look at different areas to see if you are deficient or if you need to work on adding different sources to optimize your nutrition during the course of your treatment. But for some patients that are undergoing treatment, your diet might look just like, here, obviously, a plate. Here it goes, macaroni and cheese. It might be something that's, something that's like more of a comfort food or something that you feel like you're able to tolerate. And there's nothing wrong with you making some of these selections. The goal during treatment is managing side effects associated with treatment as opposed that's definitely the goal. So if we have to modify those nutrients and look for things that are more tolerable, then we're going to be focusing on that. That's something that you would be doing with your dietitian. One of the biggest challenges for a lot of patients, obviously, is ensuring maintenance of adequate hydration. I cannot stress this enough. If you're receiving treatment, absolutely you want to make sure that you're hydrating well. Good rule of thumb from the majority of people, 8 to 10 glasses of water. But when it comes to your hydration, all the fluids take into account what the volume you need is. So water, milk, juice, decaffeinated tea, coffee, soups, broths, protein drinks. Protein drinks that you buy at the store, they're about 70 to 80% water. Okay, so that also helps go towards your hydration. Okay, caffeinated beverages, alcoholic drinks can increase fluid loss through urination. So we want to make sure that we're drinking a good amount. Okay, especially if one of the side effects that you're having with your treatment or after you've completed treatment is constipation. We want to make sure that you're having an adequate amount of fluids. In regards to the actual amount of fluids, it will be individualized. I gave you obviously 8 to 10 is we usually say that 2 liter mark. But if you're a very petite woman, that number might be a little bit less. It is actually based on your age, your weight, and it also can, you might need a little bit more or a little bit less depending on whether you have a history of possible congestive heart failure or if you have chronic kidney disease. So those numbers are very individualized, but we do want to make sure that you get adequate hydration. Movement. Movement during treatment, obviously, if you're physically able to, okay, I think it is very important. And what that movement looks like is very different from person to person, okay? One of the guidelines for patients, and in regards to this is for not only oncology, for cardiovascular disease, for diabetes, is that we want to aim for at least 150 minutes per week of moderate activity, okay? While you really want to ensure that you are resting if you're feeling increased fatigue, I do recommend from a both benefit of physically and mentally that, patients generally feel better with movement. What that movement looks like, again, I've had patients that say not really able to, get up and walk around very much, but even doing things around the house, chores around the house, whatever you can, it does help. Okay. Okay. I'm going to go into barriers of nutrition managing treatment related side effects. Okay. When you work with a dietitian, and I am going to give you a site that does have some recommendations for treatment related side effects at the end of the presentation. Things that you might be looking at is, loss of appetite. Okay. Things that can impact appetite can be possible nausea, vomiting, diarrhea or constipation, possible taste changes, mouth sores, tenderness, fatigue, pain, issues with indigestion, bloating. Those are all side effects associated with different lines of treatment, okay? When we're looking at specifically certain types of radiation and location, these side effects can be quite substantial. So for nausea and vomiting, I usually say, we don't want to be chasing that nausea if you're feeling nauseous, okay? We want to make sure that you do take the medications that are available and probably ordered by your medical oncologist, radiation oncologist. They are very effective in regards to helping manage those symptoms. But we do want to focus on small, frequent meal pattern of eating. Small, frequent meal pattern of eating does help. Even if you're not feeling hungry, if you're feeling a little bit nauseous and you're taking your medication, eating those meals, you will feel better eating every 2 to 3 hours as opposed to not eating at all, okay? There are definitely foods that are easy to digest, easier, like blander foods. If you're having nausea and you're having vomiting, absolutely we want to make sure that you're hydrating okay. So some people will use like broths. Some people will add electrolytes to their fluids. One of the brands here, Liquid IV, Mio, Noon, those are just a couple of them. There's different products on the market that you might want to look into if you're having nausea. Okay. Other common side effects might include constipation. Some people might have diarrhea. Okay. In regards to diarrhea, we're reducing your insoluble fibers, adding more soluble fibers. Some people will add Metamucil wafers, rice, bananas, toast. We do want to reinforce broths and electrolytes, fluids for constipation. Increase all fiber. Okay. Stone fruits, plum, peach, whole grains, legumes. Activity, movement helps. Fluids as well in regards to helping promote bowel movements. Fatigue during treatment is something that we will see with different lines of treatment. We want to make sure that you are resting when it's needed. However, I do recommend, again, going back to that movement, low intensity exercise, moving, doing things around the house, you will feel better. It actually makes you feel less fatigue, even though you might say, I want to like lay down. If you're feeling a little bit up and you're eating okay and you feel like you're able to do a little bit of movement, absolutely go on a walk with your loved ones. Make sure in regards to movement, one thing that I usually tell patients is that we want to make sure that you're feeling, you're not feeling lightheaded or you're feeling well, balanced in regards to being able to walk. But definitely walking with somebody in your family, making sure, you even if it's just a little walk around the block, it, definitely recommend. Okay. For poor appetite, which is something that, a lot of patients might struggle with, we usually question the cause. Is it, are we having poor appetite because it's painful? Is it, because we're very tired? Is it because we're trying to control the nausea? Is it nausea associated with constipation? So those are things that we are usually working with our patients in order to see like what is causing it. In regards to poor appetite, finding protein shakes, and there's so many on the market. We utilize them at our cancer center, different types of protein shakes. If you guys have questions at the end regarding like which ones I usually recommend, but there's so many. And in regards to some patients choose, instead of buying like a pre-made protein shake, some patients might want to choose to actually make their own at home. And I'll give you some recipe ideas at the end. So again, kind of going back to what should you be eating? Absolutely. One of the recommendations from an oncology perspective, focusing on a lot of plant-based foods, making sure your diet is balanced, including lean proteins with meals and snacks. A lot of patients, when they lose weight unintentionally during the course of treatment, they find that they're losing a lot of their lean muscle mass. Okay, we do want to make sure that you are moving. We do want to make sure that you are incorporating those protein sources into your diet. Okay, including fruits and veggies. Okay, as much as you can. If you're tolerating your treatment, again, I'm gonna encourage you to try to eat, colorful rainbow of veggies. Okay, different sources. Building a healthy plate. Okay, so ensuring that there's vegetables and fruits with each meal. I usually say breakfast, lunch, dinner. The American Institute for Cancer Research.org has really good recipe ideas. They have it broken down. If you go to that site, they have it broken down to like breakfast, lunch, dinner ideas. They have vegetarian style meals. The little meals are very balanced. They are incorporating all these different food groups in there. I usually say, especially, when you're looking, I know it says 2/3 of your plate should be, the fruits, veggies, whole grains, but definitely incorporating at least 1 cup of your plate should be with different types of vegetables if you can. What those sources look like can look very different from person to person. Okay, so if you're going back to, patients that might be struggling with dysphagia, difficulty swallowing, we are more so you can still incorporate those vegetables. They're just going to be either pureed, or they're going to be soft, or they're going to be in like a smoothie or a juice. So it just really depends. Choosing more leafy greens, bright colored vegetables. Um, when choosing starchy vegetables, potatoes, corn, peas, etc. Also choose some greens or salad to go with your plates. When we look at whole grains, okay, we do want to include them. If you're feeling okay and you're tolerating your meals, absolutely. The whole grains, we're looking at less processed, higher fiber. Those have B vitamins in them. So you do want to limit your portion to 1/2 to 1 cup of cooked grains per meal. Okay. When choosing grains at the meal, choose also non-starchy vegetables like spinach, broccoli, zucchini, eggplant, carrots, Brussels sprouts, salads, many to go in combination with your whole grains that you're also incorporating. Okay. Lean proteins, okay? So if you are adding protein sources into your diet, you're trying to attain a healthy weight, and you're, want to make sure that you're getting good sources. Lean proteins, I would be choosing more like poultry, fish, eggs, plant-based proteins, beans, nuts, seeds, tofu. These are all good sources, okay? When we'll limit your portion of cooked protein to about 3 to 6 ounces per meal. Okay, that's a good rule of thumb, especially if you're struggling with you trying to maintain like a healthy weight. That's actually an appropriate portion. But again, these are just general guidelines. It is very individualized because your protein needs are dependent on your weight, your medical history. So you are going to be, you can go over those if you are seeing a registered dietitian, or if you have any questions individually, you can always ask me. I'm available. But it really depends on many other little factors. Okay. Adding snacks in between meals. So usually I recommend focusing on small frequent meal pattern of eating. These are for patients that are undergoing treatment. You do want to add snacks in between meals. What your snacks will look like will be obviously very dependent on where you are in regards to your treatment. So here's just like apple slices with some nut butter. Some people will do like small yogurt. Some people will do like hummus with chips, or hummus with like veggies, carrot sticks, or cucumber. Some patients that are not able to eat these textures, they might be doing something soft textured foods like here, Boost or Ensure or Kate Farms. There's so many different ones out there, or they're making their own homemade shakes. Some people might make like a yogurt parfait here, like some like granola or some fruit added to some yogurt. Some people might do cottage cheese with fruit. So there's different pairs and different snacks, but we want to make sure that you do have, especially if you're undergoing treatment, I usually say do things that are easy to grab. You might have increased fatigue if you don't have your caregiver at home that's helping. Some patients might not actually feel the desire to go and prepare their meals. Okay, so it's basically looking for easy to grab snacks. Okay. I'm going to go into several different managing myths. And there's so much, there's a sea of nutrition information out there. I like this little cartoon. It says, more and more patients are going to the internet for medical advice. To keep my practice going, I changed my name to Dr. Google. Okay. A lot of patients, when they come to see a dietitian or they're diagnosed with cancer, they do have a lot of questions in regards to their diet. I know that from as a dietitian that's been seeing so many oncology patients, nutrition is the only thing that you have control over in regards to what you can do. How should I, the questions that I get, how should I be eating? What should I be doing? Okay. Again, while you're undergoing treatment, the dietitian will be helping you in regards to managing those side effects. But, we do want to make sure that you feel comfortable with the way that you are, the way that you want to eat during treatment. So I know that for me, when my patients come to see me, we're focusing on if you want to follow a specialized diet, we usually look at that diet and we want to make sure, is there anything that's lacking in that diet to ensure that you are getting the correct amount of calories, protein, your macronutrients, okay? But to go forward, I'm going to show you our first myth that we see all the time. Sugar directly feeds cancer cells. Okay. So what is it behind this myth? Basically, while it is true that cancer cells consume more glucose than normal cells due to their high energy demands, this does not mean that eating sugar will directly speed up cancer growth. Okay. I cannot stress this enough. Okay. The body is very tightly regulates your blood sugars in your diet. There is no evidence to support the notion that cutting out your sugar will slow down your cancer growth. Okay. However, when you consume an excess amount of sugars, we do know that that can lead to significant weight gain. It can also lead to possible insulin resistance, which may lead to chronic inflammation. And that is where we say we do want you to limit those added sugars in your diet. However, a diet here we go, a diet high in processed sugars can lead to obesity, which is a known risk factor for developing certain types of cancer. So we want to make sure that we're limiting those things. Okay. The takeaway from this slide is most carbohydrates are broken down into sugars or glucose. Carbs are a vital energy source, particularly for muscles and brain. A healthy, balanced diet includes a variety of carbs like fruit, grains, and beans. Too much carb sugar intake can lead to weight gain and more fat mass. There is a direct association with obesity and development of certain types of cancers. Myth number 2, when you're looking at superfoods can cure cancer, okay? I have patients that show up to clinic and they have bags and bags of different supplements that they're taking. I wish there was a superfood or a supplement that I could say, this is what I want you to take. This is, this will help cure the disease. That's not the case. Okay. The term superfood and marketing term often leading to the belief that specific foods like blueberries, kale, or turmeric can single-handedly prevent or cure cancer. It's not correct. Okay. While these foods do have a beneficial vitamin, mineral, and antioxidants, there is no evidence that any single food can prevent or treat cancer by itself. Okay. We want to look at balance. We want you to be incorporating a variety of fruits and vegetables in your diet, whole grains. Okay. This is for overall health. Remember, we're not just looking at cancer, we're looking at prevention of diabetes, cardiovascular disease, if we can. Incorporating a healthy, balanced diet is a way to reduce cancer risk and also reduce other diseases. The takeaway from this slide is Variety, balance, and moderation are hallmarks of healthy eating. Nutritious foods should be used to support a strong body and not cure disease. Now, remember, appetite can vary during treatment. Allow for differences in food choices. Okay, I'm going to pause here for a second and I'm going to go back to those patients that receive radiation, especially if you're receiving radiation in your head and neck area. Okay, eating is a big challenge for patients while they're undergoing treatment. Okay, some of those side effects can last for a while after treatment. Okay, some of them are long-term side effects. Some of them, will resolve after the treatment, probably like a month out from treatment. So what that diet looks like, it might not look like a big salad full of like veggies. It might look like pureed foods and, it's very modified. So I want you to be aware that there is nothing, we do want to make sure that you're getting the calories and the proteins, and how those foods look while you're undergoing treatment might not look the way that you want it to look. Myth number 3, all natural supplements are safe and effective. Again, I've had patients come in with multiple supplements. While you were undergoing treatment, I'm going to tell you one of the oncology recommendations is that we don't want you to be adding a bunch of added supplements while you're receiving treatment. Some of them might interact with the treatments that you are being provided. Okay, so we want to make sure that they don't have an interaction with the medications or treatment modalities that you're receiving. So while some supplements may support overall health, others can interfere with cancer treatment and even promote cancer growth. Okay, I've had patients that have had multiple supplements and they're starting their treatment, they're within treatment, and all of a sudden their labs start to look a little bit altered. Okay, one of the first things that the oncology team might look at is, what are you actually taking in addition to food? Okay, the best way to get those vitamins, minerals are honestly through your diet. Okay, a balanced diet, takeaway, a balanced diet can provide all the nutrients your body needs. Okay, some supplements may potentially interfere with treatment medications. Okay, important, consult your medical team when you are adding natural supplements. I know that I have a lot of patients that come in, and when they come to see me, they'll say, my family member brought this supplement. They said that I need to add it into my diet. Always run it by your medical team. We want to make sure that there are no interactions, okay? And usually I will tell patients, we can wait, hold off until you've completed treatments. And at that point in time, we can have that discussion again, whether we want to add them into your diet. Absolutely. If you have a vitamin deficiency or if there's something altered in your lab, that is a completely different, discussion. We do want to make sure that that we are giving you what is needed in regards to supplementation if you have a deficiency. Myth number 4, a strict vegan diet prevents cancer. Okay. While a plant-based diet is healthy and may reduce risk of some cancers, there is no evidence that a strict vegan diet alone can prevent or cure cancer. Okay. I do have patients that are vegan when they come in, and absolutely, I think it can be a good diet. We do want to make sure that we're not that we are incorporating good sources of protein, or that we're optimizing and making sure that the calories are appropriate while you're undergoing your treatment. Okay. The benefits of a plant-based diet eatings come from high levels of fiber, vitamins, and antioxidants, but balance is crucial. Okay. Including lean proteins is essential for overall health and effective cancer prevention. Okay. The takeaway, any diet that is really restrictive and now omits certain food groups, not always recommended. Okay. If you're able to meet your needs with the restricted diet, then that's fine. But we do want to make sure that, a lot of patients might liberalize their diet while they're undergoing treatment, because we want to make sure that, that you're getting those calories that are needed. Okay. All foods can fit into a healthy eating pattern. Moderation is key. That is the big take home message in regards to food choices. The moderation is key. I'm going to move on to show you some other sources. So I'm going to actually stop sharing this and pull up something else. Okay. Okay, hold on. Where am I? There. I want to share this site because I use it a lot during the course of treatment. Okay. I think a lot of patients, when they're looking at, and I know that there's different sites. I do really like this site. When patients are undergoing treatment, a lot of patients do have that question, what should I eat? Again, kind of like what we were discussing, and how do I manage those side effects associated with treatment? Now, obviously, if you're seeing a dietitian, they're going to help you choose and make some selections. But if you have family caregivers at home, this might be a nice site that you can use. Okay. So this one is called cookforyourlife.org. Okay. It has it broken down into in treatment, survivorship, and prevention. What I like about this site is that if you go up here to the top, and you look at recipe ideas, okay, it has it broken down by health consideration, okay? So when you're looking at this, patients that are having difficulty swallowing might want to click on easy to swallow foods. It'll generate some foods that might be easier in regards to preparation at home, okay? If you are a person that is following a dairy-free diet due to intolerance, you can click on preferences. You can put, possibly like dairy free. Okay. So it's going to generate easy to swallow foods that are dairy free. Okay. This has many, many different selections. It has selections for patients that are vegetarian. So if you're struggling with weight, you might want to go to high protein or high calorie foods. And if you're following like a vegetarian diet, it'll actually give you some vegetarian options. Okay. So it's a good source to help for those that have caregivers at home, help prepare meals. Okay. I'm going to show you how I use it, especially in the setting of radiation treatment if you are struggling with swallow. For a lot of patients, they do homemade protein shakes. Okay, so under health considerations, if you go to just high protein foods, because you want to ensure that you're adding some protein sources. And if you go to meals, you might want to click on beverages. There are some smoothie ideas here. Okay, a lot of my patients do use these smoothie ideas, and let me show you how you will alter it. Okay, it's just if you're trying to build your own smoothies at home, you might want to click, let's say this one is a blueberry tofu smoothie as an example, okay? It'll tell you what the ingredients are that they're adding, okay? And it gives you the nutrition breakdown. I know a lot of patients will be like, say, they met with the dietitian, this is their caloric goal, this is their protein goal. How can I, if I'm eating a modified diet and it's basically just liquids, how much should, what ingredients should I put in there? A lot of patients, when you're struggling with eating, specifically if you're receiving radiation, so like, and you're having issues with swallow function and it's just painful to swallow for a period of time during treatment, a lot of patients will make smoothies. And what I'll say is like here, an example for this recipe, it's 257 calories. If you substitute out here the ingredient, a cup of almond milk for, let's say, a Ensure or a Boost or one of those already pre-made shakes, now we're talking about a higher calorie shake. Okay. So I did want to show you this site. It also has, some healthy meal ideas for those patients that are looking for healthy options in regards to diet. But this is definitely a site that I strongly recommend. Okay. I'm going to show you the other site that I initially started out with that I usually like to share with my patients. Hold on 1 second. Let me open it up. Sorry, I'm going from one place to another. Hold on. Okay. So this is the American Institute for Cancer Research.org. That is where we had that blueprint of recommendations. Okay. Here we have diet tips, okay, for those of you that are just looking at, eating healthy. And basically, here is that plate that we were talking about earlier. And I like this site. If you're not familiar with it, a lot of patients like to explore certain foods, okay? So here it is foods that have been shown, no single food can protect against cancer by itself, but a combination of all these different veggies and plant-based foods absolutely have health benefits. This site is really good. You can click on each of these food groups and it basically tells you what the research is, okay? And then it says here, what should we be limiting? But again, going back to balance, alcohol, processed meats, red meats, we want to limit them, and sugary sweetened beverages, okay? With this site, Andre, you're able to see, right? The site. I just want to make sure. Okay. Um, they also have healthy recipes, okay, which is for meal planning, okay, and they have it by dish, by different meals, whether it's like breakfast meals, dinner meals. So it'll populate different types of meals that you might want to look into in regards to recipes. A lot of them are easy to follow recipes that you can incorporate into your diet if you're feeling up to it. Hold on, back to here.
Those sites look great, Patricia. Thank you so much. We'll definitely include those links as well for people to.
I think those are really good. Okay.
Yes,
I'm
absolutely.
going to share, here we go. I'm going to share one more thing. Okay.
Okay.
I know that a lot of patients struggle with constipation. Okay. So I'm going to share one of the recipes that I share with a lot of my patients, which is really good. I don't know if you're familiar with it. It's called yakima paste.
Okay.
Have you heard of it?
I have not, so I'm
Okay,
interested.
hold on a second. Let me share it with you. Oh gosh. So this recipe is actually found in the American Cancer Society, and I know it's found in different other, when you look it up. But basically, we call it a fruit paste. It's called yakima paste from the way I see it. But it is made with senna tea leaves. Okay. We usually the one that I usually recommend uses like smooth move tea as part of the recipe. Okay. But this has prunes, raisins, figs, prune juice, brown sugar, lemon juice, and it gives you the instructions on how you make this at home. It's a little tea, okay? When you cook this down, okay, it's gonna make a paste. That paste, you can put it and store it in the freezer, okay? A lot of my patients that are struggling, with constipation and they're saying, I've taken medications. A lot of patients will try this and it can be effective for some, okay? You grab a tablespoon of this mixture once it is prepared, and Andrea will share with the group the link, but basically you can put it in a nice, like a cup of some warm water, and you basically just put a tablespoon and you make yourself a little tea with it, okay? It can be very effective. Obviously, I want you to be careful. Obviously, run it by your doctor if there's any other issues that why this would not be appropriate. But for the majority of patients, a lot of my patients do take this paste to help with their symptoms of constipation. Okay.
Awesome.
Okay. I did want to leave time, obviously, to answer questions as they arise. Okay. And that's the end of my presentation. And I will be sharing my slides with you, Andrea.
Perfect. Yes, and we'll post them on our website in the recording as well. So we'd like to take the opportunity now for anyone to ask questions. If you do, you can put them into the Q&A feature. As people are thinking of questions, Patricia, I wanted to ask you a question specifically in terms of at what point, I know you mentioned earlier in the presentation that really getting an evaluation by a dietitian nutrition is really something that should happen maybe at the kind of time of diagnosis before any type of treatment starts to really get a baseline. For people who have already gone through treatment or in a kind of a survivorship place or years out from treatment and are kind of just maybe doing annual follow-ups with their oncologist or their doctor, what do you suggest is the best way for them to get connected with a nutritionist? And does that nutritionist necessarily have to be a nutritionist at like at an oncology cancer center? Can they go to their primary care doctor? What can you kind of talk about what the best way for folks who are not currently in treatment to do that would be?
So I am going to tell you, anybody that has undergone any type of oncological treatment, I usually do recommend that you do follow up with an oncology dietitian. That would be like my recommendation. Okay. An oncology dietitian doesn't only focus on your, cancer diagnosis or whether you had your cancer treatment. They will work with you in regards to looking at other areas to prevent, development of any chronic disease. So if you basically finish your treatment and now all of a sudden it's been a couple of years out and you have diabetes, absolutely, I would still want to focus back and kind of fall back on that oncology dietitian, which should be able to help manage you as a whole in regards to like what are your recommendations, okay? A lot of patients that get diagnosed and I like we stress basically at diagnosis, I have patients that might delay, we get a referral and they'll say, I'm eating fine. There's no issues. It is a nice time to get a baseline assessment. Even though you're eating fine, when you start treatment, things of may look very different like 3 weeks into treatment. And at that point in time, you want to have that relationship with that dietitian that's basically going to, like, what was your baseline? Where are we at? What do we need to do to help you? The dietitian is there to help you during this process to help manage any things that arise. Okay. Other things for a lot of patients in regards to oncology, there is a lot of literature out there in regards to being again healthy weight, making sure that you're eating well, reducing other comorbidities. So absolutely, you do want to reach out, get a referral from your doctor, your doctor. But if there is no oncology dietitian, absolutely just going to a registered dietitian, they should be able to help manage some of your.
Awesome. Thank you. Another question that came in actually through the chat, I think it was someone who had to hop off early, was asking about, I think, navigating weight gain after treatment has ended in terms of like losing weight and things like that after you've completed treatment. Um, Possibly weight gain from medications or, anything like that.
Absolutely. I do have, so I personally follow a lot of patients that have finished treatment. They lost weight initially, and now all of a sudden they're like, because of certain types of medications, they gain weight. Okay. And I think, again, going to your dietitian, they will be able to help in regards to talk to you about what the balance is, what is the appropriate macronutrients that your body will require to help induce weight loss, but not a rapid weight loss, that are they're eating very balanced in regards to all the food groups, and kind of showing you and what alterations we need to make in regards to um, your individual dietary needs. Okay, because it's not a cookie cutter recommendation. Everybody's a little bit different to see what it is that's driving that weight gain. Yes, for a lot of patients, it might be medications. Okay, some patients I follow patients that are, from in at UCSD, I'll follow patients that have finished breast cancer treatment or, prostate cancers, gynecological cancers that are trying to lose weight, and any different other cancers that they say, I'm weighing more than I've ever weighed. Okay, so we do help ensure that you're getting the right nutrients, but at the same time, help you lose weight at a not rapid pace. I don't usually recommend a rapid pace because you want to make sure that you're maintaining your strength because of everything that you've undergone previously.
Absolutely. Thank you. Okay, let's see here. We have another question here. What labs do you like to look at to see if there are vitamin or mineral deficiencies?
So in regards to labs, it would be more so, so from the oncology perspective, usually the labs are usually your CBC. So basically looking at are you having any type of like microcytic anemia, macrocytic anemia. We look at vitamin D level. I usually recommend and encourage you, if you finish treatment, absolutely. There's a lot of research out there looking at vitamin D deficiencies in certain types of cancers. So we want to make sure that you are having that lab drawn at some point in time with usually with your primary care doctor, I usually say, because we want to make sure that you're supplementing accordingly. Okay. Um, it's going to be very individualized in regards to, if we feel like there is, some other deficiency that seems to be presenting for those patients that are, have lost a substantial amount of weight or, are not eating very well, then we'll probably ask for some additional labs.
Awesome. Thank you. Those are all the questions I see. Does anyone else who's attending have any questions? If so, you can pop them in the chat, which is where most of the questions are coming in, or use the Q&A feature as well. Either one works fine. It looks like we're closing, on time. We have a few minutes left. So if you do have questions, feel free to go ahead and ask them now. If you think of questions later down the road, like tomorrow or anything like that, you can definitely reach out to us at the Chordoma Foundation. I'll put our email address where you can reach us, and then we will be able to get some of that information to you. Lots of thank yous coming in from folks now. Patricia, it was such a great information that you shared, and I'm so glad that we'll be able to share this with folks going forward as people are newly diagnosed and they have questions. I think this will be such a
I
resource for them.
I do want to close with this. I know that I've expressed to you, Andrea, I am absolutely as a resource, if you are getting ready to start treatment and there are and exactly what your treatment regimen is going to look like, please feel free if you do have some questions specifically regarding your individual case. I am available to answer some questions. You can forward them to me.
Awesome. Thank you. I see one more question that came in is, what's the one thing you wish patients asked you initially?
Oh gosh.
Never been asked that question before, have you?
No, I have not. I'm actually, what was the question that I wish they'd asked me initially? Um, I feel like they ask every question under the moon. So it's I think that one of the things that I do when my patients come in is I want to ensure that we are in line in regards to what you want to feed yourself. Okay. So basically if there are patients that come in and they are already, have done the research and they say, I want to follow more of a plant-based diet. We do want to know those things because basically our recommendations are going to be in line with those recommendations. But otherwise, I mean, I have patients that come in and they say, Patricia, I'm eating okay. Or some patients might say, I'm not quite sure why I've been sent to a dietitian. It's because eating during the course of different types of treatment looks so different. Some patients might start treatment and it might, if they're really struggling with eating, it might look like nutrition support. So basically, I feel like asking different questions, absolutely, whatever they feel like they need to get answered.
Perfect. I think we might have one more question. Is there any specific food that should be completely avoided?
Avoided, not really. Okay. It's more limited or reduced. Okay. I would say alcohol is one of those foods that I usually say limit or reduce. Um, yeah, it's pretty much the list that I gave you in regards to limiting or reduce. Again, patients undergoing certain types of treatment, they might really struggle to eat anything. So we really are more so looking at what is it that you're able to eat, okay? And those are things that are going to be very individualized, okay? So it just really depends on what is your back history. What are things that I might say off the board that would be something that's limited might be, someone that's coming in with chronic kidney disease and they are following a very strict diet. We're going to follow that diet restriction based on, that their kidneys are not functioning. So certain foods might be limited. But in regards to while you're undergoing treatment, no, it's more management of side effects. And I cannot stress that enough.
Wonderful. I don't see any other questions here, and it looks like we are approaching the end of time. Patricia, again, thank you so much. for joining us today, for sharing so much wonderful information that I know is helpful for today. It'll be helpful in the future as well. Um, so again, we will take care of the recording for everything. We'll post it on our website along with the links that you've shared, access to all the resources, your presentation slides, everything like that. And if questions come our way, we'll send some of them your way for sure.
Absolutely.
Thank you so much.
Okay. Thank you, everyone.